Hi, everyone, and I want to welcome you to the Self-Care Forum podcast. My name is Dr. Cedric Bachetu, your host for the hour. Here on this podcast, we bring knowledge to empower you and address the root cause of your disease. Our goal is simply to interest you in the care of the human frame, in diet, and in the cause and prevention of disease. Today, we're joined by none other than Petula Griffith, also known as the Footcare RN. She is the owner of the Footcare RN, the first nurse-owned and operated foot care service suite in the Westchester, New York City area. Petula has over 20 years of nursing experience with additional training in foot care. She is a certified foot care specialist, CFCS, with the American Footcare Nurses Association. Nurse Griffith, I want to thank you for joining us to the Self-Care Forum podcast. All right.
Thank you, Doctor.
Yes, thank you for taking the time out of your weekend to join us and certainly enlighten us. We truly appreciate it. So before I begin, I always like to learn a little bit about the guests that we have on. So I want to talk a little bit about what inspired you to begin your journey into nursing and ultimately into foot care. So just starting, what made you or what inspired you to become a nurse?
Dr. Cedric, I have nurses in my family. However, I just was always drawn to people, just the art of caring, being around people. And I felt that that was the direction that I wanted to go in. Mm-hmm. As concerns to foot care, we have diabetics in my family. We have a familiar history of it. And unfortunately for me, we had the experience of my grandfather who had to deal with decision-making with amputation because of lack of good foot care. Being a nurse on the floor, I also felt that we could have done more for our patients at the bedside. I feel that part of the interdisciplinary team that we could be more hands-on in providing basic foot care at the bedside.
So where did you go to school, Petula?
I went to school in Westchester. I went to Pace University in Pleasantville, where I completed both a degree in business administration and in nursing as well.
Oh, wow. And how long have you been practicing as a nurse?
I graduated in 2000, so this will be 22 years.
Wow. Wonderful. Yeah. Well, thank you for giving us an enlightened background. So let's focus a little bit on foot care, on the theme of today's podcast. So over at the Footcare RN, you offer foot care services. But just begin, what are some barriers to people getting foot care? Because it's, just speaking from my personal experience, it's not something that comes to the forethought of people's minds, right? Like I haven't thought about my foot, in years, really. Now that we're having this conversation, I'm, just looking at my toes and looking at my nails and making sure that everything is healthy. But, in your experience, what are some challenges or some barriers to people getting proper foot care?
I believe that the feet are not seen. So it's almost, we're not looking at it, we don't address it. Foot care is also unfortunately looked at as a cosmetic service, which it really isn't. And just as we go for our yearly checkups, I believe that it is very important that we also go for yearly checkups because of our feet. Feet is something that we don't discuss at home. We discuss, yes, we get shoes, but it's definitely something that we don't discuss until something happens. So the discussion of feet really need to start from childhood. As young people growing up, I'm from the West Indies. We often hear people say, wear the shoe, it will stretch. That's where the problem begins, not when we start wearing high heel shoes.
Okay.
Yeah.
Yeah, it's common in African households as well. You know, make it do. No matter what you get, just wear it.
Yeah.
Yeah. So let's talk a little bit before we dive into some of the different services that you offer, and you offer, you know, a very broad, you know, services. I mean, you touch everything from, you know, fungal infections to ingrown toenails to, you know, diabetic feet. What do healthy feet look like? So when we look down at our toes and our feet, what do we want to see? You know, what does a healthy foot look like, essentially?
I want to first tell people a healthy foot does not look like the foot that you see in a magazine. Healthy feet are well moisturized, they are supple, nails are clear, without infection, without pain. That's a healthy foot. When we look at the undersole of the foot, it's pink. For darker pigmentations, it may be just a little darker than the average. Toenails are not curved, they are straight across. For some of us, we may not have the idyllic toenail. And again, I have to say for darker pigmentations, because what a person of African or Asian background, how their foot would look compared to a person of a Caucasian background may be completely different.
Wow.
But you want your skin to be well moisturized, not dry, not flaky. You want the soles of your feet to be intact. You want them to be without pain. That's a healthy foot. If you look at a baby's foot, your foot should really emulate that. Feet should not have corns on it. Corns is telling me that you have a shoe problem. It becomes about because of friction, because of pressure. Calluses, we're all going to get calluses. Unlike the baby, we're moving around more. But if you have an increase in callus, it's telling me that something is going on. And oftentimes that's a shoe problem. It could be a weight problem. It could be a gait problem.
Interesting. Now, you bring up shoe problems, but there are other sources for, you know, foot issues. For example, you know, diabetes affects, you know, over 10% of the adult population in the United States today. One of the things about diabetes is that it's uncontrolled blood sugar. For those who may not be familiar with what diabetes is, essentially, when you consume sugar, your pancreas produces insulin, and the job of the insulin is to take the sugar out of your bloodstream and place them inside of your cells so that they have energy to function. Whereas when you're diabetic, the insulin that you're producing is not working very well, type 2 diabetes, that is. And so the sugar stays in your blood. And of course, that's going to cause all sorts of issues. One of the more common issues is what happens to your extremities, so your fingers or your toes. And so diabetes is commonly associated with diabetic foot issues. And so how do you treat that? Or what are some of the experiences you've had dealing with diabetics who've come into your office?
Diabetics that come into my office deals primarily with preventative care. So the diabetic that's coming in will often present with dry feet. And this is because perhaps, you know, blood sugars are uncontrolled, and hence the reason why the skin becomes more dry. So the barrier, which is the skin, becomes compromised. Diabetics need to come in, they suffer from loss of protective sensation or neuropathy. They're no longer sensitive to cold or to heat. So therefore, they are at risk for injury. They're at risk for infection. So a client like that coming to me is coming for a safe environment to ensure that nails are cut using utensils that are sterilized, to ensure that their calluses and their corns are being addressed, because that can build up in the shoe because of dryness. You'll also see it in the heels. So these are the things that are important. Also to be able to check on them at least every 6 months to a year to see if that neuropathy is advancing or not. In the office, we also discuss nutrition and ways that the diabetic is able to better manage their condition. If there is need for a referral, that is done. But the hope is that the foot care will prevent things such as ulcerations or sores. Sometimes someone may not be able to see the bottom of their feet. They may not be able to reach. So things may build up more on that client versus the client that is more mobile.
And that's interesting too, because with regards to diabetic foot neuropathy, a lot of times, because they can't feel pain, they tend to ignore things that they should have paid attention to. And by the time it's discovered, it's gotten worse. Am I correct?
Definitely. One of the things, I'm glad that you brought up pain. One of the things that I am noticing as well, not just with diabetics, but also amongst non-diabetics, that people are considering pain to be normal. Pain or discomfort in your foot is not normal. Trying to wear a shoe that is uncomfortable is not normal. If you're walking around and you are having pain, maybe in your heel or your toe or your knee, it has to be addressed. Pain is not normal. Pain is a red flag.
There you go. Now, what about, you mentioned something about darker skinned people, and, earlier you and I were discussing melanomas on skin. And so you had something interesting related to the significance of melanoma on darker skin. Can you elaborate on that, please?
Melanoma may not be much different than it is on the Black skin as it is on the Caucasian skin. However, Blacks need to be more mindful because it may bypass, they may look at it as insignificant because it may resemble maybe a sore that's there, but anything that's new, anything that has a change in shape needs to be addressed. And I'm going to discuss that more in the slides as we go ahead.
And it's also easy to overlook because, it tends to be darker skin, correct?
It is, and darker skin people tend to pick up melanomas in areas of sun exposure, which will be your hands and your feet.
So let's talk a little bit about fungal infections. This is a common thing. As someone who works in healthcare, we often dispense, clotrimazole, miconazole, ketoconazole. These things are very common in my line of work because we're dealing with a lot of fungal infections. And by the way, these things are readily available at your local pharmacy over the counter. So there's really no need for prescription. But, let's talk a little bit about the significance of fungal infections. Where do they come from? Do they come from tight-fitting shoes, people, walking in moist areas? What can you tell us about that?
We all have a level of fungus on our skin. When the fungus presents on the foot as athlete's foot, or it presents on the toenail, what we call onychomycosis, that means that there's an overgrowth. That means that there has been a break in the barrier. And with exposure, for example, fungus grows in dark, moist environments. So you have somebody who may be, during the summer months, feet are more sweaty. You may be suffering from something called hyperhidrosis, which is excessive sweating. Some people are unfamiliar. They may say, oh, my feet tend to be, I noticed I'm changing my socks more, I have wet feet, not knowing that they are creating an environment. And oftentimes, even though hyperhidrosis can be diagnosed, it's often not identified until later on. So you have a moist environment, you have a dark environment. Those are conditions to create athlete's foot. It's a condition when the nails, the barrier of the nail is broken and it invades. So sometimes you may notice that the tip of your toenail is lifting. That encourages the fungus now to invade the nail plate. And that's how you end up with the toenail fungus. Dry nails, cracking, that will encourage the fungus on the nails. And we often see it on the big toes.
Thank you.
We have women now that are using cosmetic enhancements, gels and acrylics on their toes. This creates an environment for toenail fungus.
Wow, interesting. So speaking of toenails, tell us a little bit about toenail bracing. What is the purpose or the use of bracing the toenails?
Toenail bracing is a non-invasive procedure. If you have an involuted nail, not an ingrown nail, an involuted nail is a nail with an extreme, I have images of it, an extreme curvature. Oftentimes you will hear someone say, my toe hurts at the side. I don't know if any of our audience members, they will say, you know, I noticed that my toe is hurting. They often refer to it as an ingrown. It's not an ingrown toenail. It's an involuted nail. An ingrown toenail is when the nail itself breaks the skin and you notice it becomes red, it becomes flame, it may even become pussy. If the nail is involuted, I'm able to put either a composite or resin, which almost looks like plasticine, on the nail. It hardens on the nail, and over time, as the nail begins to grow, the curvature of that nail will relax and you will not have any pain. But the factor to that is you have to change your shoes. If the shoes remains tight, if the cause is still there, and oftentimes the cause is the shoe, then it's not going to help.
Speaking of shoes, because shoes seem to be another major culprit for a lot of these foot and nail issues. Are they related in any way to corns and calluses?
Yes, corns and calluses, because of the friction in shoes, the friction caused by improper footwear will cause corns and calluses. Oftentimes, maybe the way that we walk, our gait. Sometimes some of us tend to walk at the sides of our feet. Some of us tend to roll in, and we will notice that the corn, not the corn, the callus will be seen under that great toe or your big toe. Corns are more common on the top of the toes versus the underside. So the underside will refer to callusing on the soles of the feet. The top of the toes will be the corned areas.
Oh, wow. Thank you for clarifying. Now, you use the term improper footwear. You know, what exactly is that? Are those tight shoes? Are certain shoes better than others? Or rather, what should we look for when it comes to shoes to wear?
When you're wearing a shoe, you want your feet to be relaxed. You want the toes to be able to splay in that shoe. So the shoe is to fit your foot, not your foot for the shoe.
Okay.
So somebody may have, we have a question, somebody may say, I have wide feet. Okay, you may need wide width shoes, but some people may have a wide forefoot, which is the front of your foot by the toe area. You don't need a wide width shoe. You just need a shoe that will accommodate the front of your foot. So we often say you need a wide toe box or you need a deeper toe box to accommodate that foot.
Would you suggest we get shoes that are maybe half a size bigger than where our foot is to give us breathing room? Is that helpful?
No, you need to get your feet properly sized, because sometimes somebody may have a foot that is larger than the other foot. You want to be able to size your feet correctly, and that is using, let me get this instrument for you. I don't know if you've gone to your shoe store. This is a Brannock Device, and most shoe stores should have this in. Maybe if you go to the big department stores, you may not have it, but everybody needs to have their feet sized at least once a year because it changes. With women, we change because of childbirth. Oftentimes we may start off as a size 8, but as we age, you might be a 9 or 10 in shoe size. And that goes for men as well.
All right, thank you for that. Now let's talk a little bit about the cosmetic area. Let's talk about things such as skin peeling and exfoliation. In your opinion, what is the importance of skin peeling and things such as exfoliation?
Everybody needs to exfoliate once a week. We build up callus on our skin just as you would shower, and we use a washcloth, which is a form of exfoliation. You need to remove that dead skin. If you don't remove the dead or the hard skin on your feet, then the moisturizers that you're using, it's not going to work, and it's not going to make the skin supple and pliable.
Wow. So this is the whole foot, the underfoot, on top of the foot?
No, just the underfoot. You get a foot file, a proper foot file. You exfoliate the soles of your feet. You always wash between your toes and dry between your toes carefully, because those are areas that can accumulate moisture. Some people would notice between the third, we call them web spaces. So you have 1, 2, 3, 4. Between the third and fourth, that's oftentimes where the toes are close together. You would notice that you may end up with macerations or toenail fungus.
Now, when should we consider toenail reconstruction? I assume things would have to be pretty bad, but when do you see a need to recommend somebody for toenail reconstruction?
Toenail reconstruction is a cosmetic procedure. It's not used for curing anything. Somebody may have a damaged nail because of injury or because of toenail fungus, where the bed of the nail or the matrix of the nail is damaged and the nail will not grow back. Some people may have pincer toenails and they want the nail to just look a little bit more pleasing when they go out, especially in the summer months. I have an image that I'm going to show the audience of a male and female client where this was done.
Excellent. Now, by the way, you have the floor. Did you want to share your screen?
Definitely.
Okay.
This first slide is a slide of a 95-year-old gentleman. And I always tell clients that all feet tell a story. This gentleman was a caregiver for his 90-year-old wife who has cancer. He was a veteran, a professor, and now he has a father, and now he has rheumatoid arthritis. He said to me, "Petula, look at my feet. My mantra is all feet are beautiful." Why? Because he's made it to 93. And his beautiful feet has nothing to do with his snarl toes or his fungal nails. This is a guy that keeps trooping just like most of us. The next slide, we all want to have a Cinderella moment. Everybody wants to get that shoe that fits just right. We can go ahead, doctor. Is this really the problem that we are having with our feet? I'm seeing somebody laughing. Is this really the problem? It's part of the problem, but not the full problem. In the office, I showed you the Brannock device. Every client that comes in, they have to have their feet sized, because I want them to know when they come in, is it that the shoe that you have, what's really causing the problem. And oftentimes, 90% of the clients that come in aren't wearing the correct shoes. They feel comfortable in them, but as we go through the slides, you would see where the problems start arising. Here, this is a slide by my foot function, and I'm showing you the foot to the left, to the farthest side, to the left-hand side. That's a relaxed foot. That's a healthy foot. You notice that the toes are splayed, meaning they're separated. The shoe that's in the middle, which will represent like a pointy area of the shoe. Then we have the shoe that's a little bit more pointed, and we're seeing where the bunion formation is starting to happen. This is a picture of my client's foot and the shoe. The red outline is a picture of the foot. The black outline is a picture of the shoe. So are you seeing where the shoe is compared to where the foot is? And she said to me, I put on my best shoes to come. Okay, you can go ahead, Dr. Cedric. Now that we're looking at this, the image of the drawn image, and I do that so clients will be better able to understand what is going on. Perhaps you might be able to identify with this as well. If you're looking at the red outline where her foot is compared to the shoe, you will observe on the slide to the left, you're seeing that area where the corn is coming on that fifth toe. On the slide to the right, you will notice that toes 1, 2, well, I should say 2, 3, 4, and 5 have corned areas. So you would notice there is a correlation regarding the shoes that we are wearing and the injuries or the formation, the callus and corns that we see on our feet. And this is why I'm saying that pain or discomfort is not normal. I think a lot of us are walking around in uncomfortable situations and considering it to be normal. This is a picture of, it's actually a Prada loafer. And I was able to identify to my client what was going on. If you notice this shoe, he has broad feet, but if you notice on this slide to the right, the V formation that it forms and the bumps, those bumps are his toes, his big toe that's pressing against that shoe when he's walking. So before I even turn this slide, do you have an idea how his toes will be looking in the shoe?
Yes, we can see it.
Yeah. Okay, let's go to the next slide. You would notice this toe had an injury, but because it's hitting, we call it a piston effect against the shoe, it's causing that toenail to become thickened. So by using a podiatry file, I was able to reduce the thickness of that nail, and you notice that there's a sense of normalcy. Now, if he continues to wear the shoe, then the nail will go back to where it was before. And that also happens to, some of us may have something called a Morton's toe, where the second toe is longer than the big toe. You would notice that wherever our feet or our toes hit against the shoes, you would observe that your toenail will be thicker. That has nothing to do with fungus, it's trauma. And because of that trauma, the micro trauma happening to your nail, that will cause the dermaphyte or the fungi to enter into your nail and cause onychomycosis. Here, You notice that I showed you the V formation, if you remember the first slide. Now you're seeing the calloused area that will show up under that big toe area. So I'm showing this slide. Do you have hard skin formation in these areas? If you notice that you have under the metatarsal area, which is the ball of that foot, that's the foot to the left. You would also notice on the great toe, you would observe that red area. Also too, under our fifth digit, or what we may call the pinky toe, commonly called the pinky toe, and also to the heel area. So those are areas of callus formation, which is usually attributed to improper footwear. Here, this is another client. So exactly what you saw in the image, you are observing under her feet. So you're noticing it's at the ball of the foot. You're noticing it under the pinky toes and also too on the great toes. This is a client that loves wearing 5 to 6 inch heels. Okay. The next slide will demonstrate, this is another client that loves her shoes. She makes a big investment. Unfortunately, in her 30s, you're observing the bunion formation. Here I'm showing you this. It says studies have shown that a large proportion of population wear incorrectly sized footwear. The foot to the left, you see that the toes have nowhere to go. To the right, you see that widened toe box to the front allows for movement of your toes. Remember, the toes are not just relaxed when you're standing up. When you're walking, your feet also spread as well. Hence the reason why they tell you to look for shoes in the evening time. So it's imperative that you find footwear that fits, starting with shoes that give your toes room and then making sure that they are the correct size. Do not pick a shoe and say it will fit or it will stretch. It should be fitting when you go into the store. Some of the conditions that we see in the office, we have macerations between the toes. As I said before, drying between your toes are very important. Macerations are just the increase in moisture, and that can come about especially in the summer months or even in the winter when our feet are closed up. And this can also lead to athlete's foot between the toes. We have cracked heels with fissures. Cracked heels may come about, one, with weight gain. It may come about because of athlete's foot. That athlete's foot will cause drying of the skin, which will eventually cause the heel to crack. Neuropathy could also cause dry skin or what we call cracked heels under our feet. So there are many different causes that we need to look at. Also too, as we age, that the calcaneus bone, which is our heel, that it takes a lot of that pressure. The fat, our fat pads may diminish below there. Also too, when we wear shoes that are close up in that area, it will shear against the back of the shoe, causing dryness and callus formation. If not addressed, the heel will crack. Hence the reason I encourage everyone to use a foot file at least once a week and moisturize your feet daily, if not twice a day. Twice a day is idyllic, but if you are consistent, once a day will do the trick. This is an example of the interdigital tena pedis, which is the athlete's foot that you're seeing. And compared to the maceration, If you have athlete's foot between your toes, it can be very itchy, which is a trademark. You can, to avoid this, you can use a foot powder between your toes, and also drying between the toes. Over the counter, you also have one of the first lines of defense that we use is turbominophen 1%, also known as Lamisil. You could also use Lotrimin. You should see results in 7 to 14 days. If you are not seeing results, you need to follow up with your doctor because something more could be going on. Before I go on to onychomycosis, I want to say to you, between the toes should always be kept dry. Don't use oils or lotions between your toes. You can use gels, which dry. You can use powders. There are also foot sprays, which will dry to a powdery formation. I have an example here. This is a foot spray. Are they seeing? Can you see my hand clearly?
Yes.
Okay. So if I'm using, this is an over-the-counter foot powder. CVS is my one-stop shop. When this sprays on, it's going to be wet, but it dries as a powder. Okay. We have here, we also see onychomycosis, toenail fungus. Here, this client has athlete's foot, and because of the athlete's foot that was left unattended, it was able to invade the nail plate. So now we have all 5 toes that are compromised with this fungus. We see here on a client, again, this is a client that has used gel nail polish, resulting in the nail becoming dry and brittle. And she too has also ended up with onychomycosis, which is being treated with by pill formation to see, if the nail itself will be able to grow back normally. We have clients that come in with various skin conditions. This is punctuate porokeratosis. This is a disease process that someone may develop. Oftentimes she developed it in her teenage years. And this is where the skin becomes very hard. And you would notice that she has multiple corns, if you'd want to call it that, over her feet. Does this condition go away? No, it doesn't. So she has to come in every 4 to 6 weeks to get her the soles of her foot debrided and to get the core area of the corns removed. That is also treated with moisturizers such as urea. We can move forward. We have thickened nails. As we get older, our nails may become thicker. Some of the 2 feet that I'm showing are 2 clients that unfortunately are unable to reach their feet. So the nails continue to be thicker. On the first slide, you will observe that that thick nail left unattended was causing the underneath of that toenail to become to bleed. So it's important to bring in elderly clients because oftentimes you don't have the instruments at home to get that attended to. The issue of socks. On the left, this is a sock company that I support called Adinka Republic. And on the right is the county executive of our county, George Latimer, wearing colored socks. I think socks are fun to wear. I especially love to see men using socks as a fashion statement. But in wearing socks, we have to be mindful of what kind of socks we are wearing and for what reason. Let's look at the next slide, Dr. said. In this slide, I'm showing what we call diabetic socks or non-binding socks. People who suffer from peripheral vascular disease, peripheral arterial disease, swelling of the legs. Oftentimes your doctor may say to you to get diabetic socks. What these diabetic socks are, they're called non-binding socks. They are non-constricting. They're able to stretch without causing creases in the feet. They're easy to go up, and they're often white in color. It doesn't necessarily have to be all white, but it needs to be white at the sole because it's easier for injury to show up. If you bumped your foot or you're bleeding, the white color will show that up easier. This is another example. This is a Canadian brand that you can get. You can also get non-binding socks at the local drugstore or your surgical supply store. Again, they are what we call non-binding tops. They will not bind or restrict circulation. So this is ideal for diabetics. It's ideal for people with swollen feet. They are sag resistant. You don't want your socks falling down. You want a low profile seam or a seamless sock. And that is because at the seam, if you have loss of protective sensation, you are not going to be able to pick up that rubbing, and that can also cause ulceration at the toes. Here's an example of a client who has edema of the feet. If you notice on the top, you're seeing that constriction. He came in with a pair of socks that was constricting his feet, and I was able to offer him a non-binding pair that will not compromise his circulation. One of the areas I want to check on is especially the elderly. Have you checked an elderly relative's feet lately? You might get a shock. Unfortunately for the pandemic, a lot of our elderly have not been keeping up with appointments. It's not just for foot, but their medical appointments because of fear of infection. So what is happening is a lot of things, we're going into an area of neglect, which is important as perhaps children, as caregivers, even as neighbors to look in, because this affects mobility, it affects quality of life, and also too, an elderly person may be at risk for falls and also a risk for infection. Here we notice a client with elongated nails. Even though toenails may go 12 to 18 months, but oftentimes we put socks on individuals, and just like we don't look at our feet, if we don't look at somebody's foot, you notice that this entire nail is literally growing over towards the fourth toe. We are dealing with dry skin. The slide on the half, again, this is a client or an elderly person that has back issues that cannot lean over. This is somebody who is conducting day-to-day business, still in the community, walking around. An easy fix: moisturizing soap, Dove, Cetaphil, water, a washcloth, moisturize, and this is the foot afterwards. So in saying that, it may be important when looking at the elderly to maybe find out, does that person need additional services? In asking a question, if it's mom or dad, you may have to consider perhaps see if a caregiver could come in, even if it's 2-3 times a week, to assist with activities of daily living, which includes showering or helping around the home. I do encourage that feet be washed, not soaked every day, and it could be as basic as a soft washcloth with diluted soap. You rub the feet, you rinse that cloth, you wipe off again, dry and moisturize. Here we have a client that came in with a hidden wound. The daughter-in-law was concerned, what was going on with the feet when the socks eventually came off. When the client came in, you could see that where we started and where we ended up, if you want to call it these ulcerated wounds, we were able to get her into wound care where she was seen by vascular and is being followed there right now. If not attended to, this is another reason that could lead to amputation. Here we have a client that's at home using a walker. This here is caused on the heel because of shear. If the foot cannot be lifted up, the dragging, this is a shearing wound. We have to be mindful of them wearing the correct shoe size. Just as we need the correct shoe size, they need the correct shoe size. This is a client in a nursing home environment. I've also seen this at home. If a person does not have the correct shoe size, not only are you at risk for falls, but you're also at risk for injury to the skin because you're going to be shearing against that shoe. Here we have callus formation. Again, even though for me it may be an easy fix, you want to know what is the cause of it. And again, callusing can again be due to neuropathy, which causes drying of the skin. It can also be, again, callusing is due to friction and pressure in footwear. So unless this is addressed, encouraging a client to change the insoles of the shoe at least every 3 to 4 months will help reduce that, as well as wearing proper socks. Socks are not meant to go on and on. Sometimes, we have to change those socks like every 6 months and get a fresh pair or a fresh set to go around again. Dry skin that can lead to cellulitis. Cellulitis is an infection of the skin. When the skin is dry and cracked, bacteria can enter and cause infection. It's often noted by the warmth and that red color. It is sometimes painful in nature. This is a client that when I went in at the nursing home, it's a client that I followed at home and he went in for rehab. So in going in, this is what showed up. He was started on IV antibiotics before he left. Here we have infection that required hospitalization. On the left, we have a client that decided to be able to handle foot care at home. This ended up turning into an osteomyelitis, which is an infection in the bone. Again, in dealing with the compromised client who is diabetic, may have neuropathy, you have to be mindful of the tools that you're using with these clients. Tools should be sterilized. It should be a one-time use. It is better that the foot be seen by a professional every 6 to 8 weeks. The foot on the right is another example of cellulitis. The discussion that I want to create regarding the foot on the right, immediate assessment revealed that something was going on. When the client was asked, when last did you see your doctor? The client said to me, yesterday. I said, did you discuss your foot with the doctor? He said, no, I didn't think that my doctor looked at feet. All doctors are able to look at your foot. Even if a doctor cannot do anything with that foot, they're able to refer you. So I want to encourage everyone who is going to a doctor's appointment, always get a pad, because people are saying now doctors are rushed. When I go in, it's like I'm in and out, especially when they go, sometimes they go to podiatry, they say they're in and out. Doctors are there to hear your concern. Write down your concerns before you go. Doctor, I know I came for X, but I have a few questions that I need to ask, and these are my questions. And you need to get a response for each of them. Ulceration. Again, if you notice on the first slide, the toe appears as if it's tented. That's called a pincher toe. So that is a painful toe. This is a client with dementia, thick toenail. In doing the assessment, I'm asking her, are you feeling any discomfort? She said, yes, I am feeling discomfort. Touching the toe was warm to the touch. In the breathing, the thickened toenail, the circular area that you're seeing that I highlighted revealed a pinpoint ulceration under there. Even though a toe is thick, it could be brittle. What happens is it creates little, if you want to call it sharpenel or that dry, sometimes that dry area or dry nail, that brittle nail can break off and create a piercing in the skin. So it's important, again, to bring in the elderly to have those nails trimmed and breeded with the proper equipment. So again, this was another client that was referred. She was able to see her primary doctor and start on antibiotics. Early intervention avoids situations going beyond where they need to go. So it's important to keep up every 4, 6 to 8 weeks to have your feet attended to. Here we have the overgrown nails that are curving. So we have a client here again who is unable to attend to her feet. So you notice that the before picture shows that it's dry. You see that some of the nails are actually curling under. Again, with proper equipment, they were trimmed and reduced, creating a much more pleasant effect, but most importantly, encouraging the client to be more mobile, be pain-free and independent at home. If we go to the next slide, you will see a close-up of the nails that are curled. So it's forming almost like a ram's horn around her toes, creating an impression. Next slide, Dr. Cedric. Here, I'm showing you a close-up. If you look at it, the orange marks are showing where that nail was actually creating an impression in the skin. If left unattended, it would have broken the skin and caused an ulceration. Mm. Okay, so it's important that the foot, that, you know, not beyond nails looking aesthetically pleasing, you also want to avoid injury, and you want to, in seniors, you want to maintain that independence at home, that they get to enjoy the things that they wish to do, and that could be spending time with family, that may be going maybe to an adult day program. They want to be mobile as well, and they need to be pain-free and injury-free. Here we have a client that has a self-care deficit. So this again is somebody in the community. I am here to ensure that clients not only feel good about themselves, but that their feet, conditions in the feet are addressed. So this client comes in every 3 weeks to have the feet done. This client does have a fungal nail involvement along with athlete's foot. It's not that the client cannot reach due to mental health concerns, is unable to address it as she would like. So the client comes in and she gets her feet done, and together with podiatry, we have formulated a plan that she would be able to take her medications and still be able to address her feet. Everyone needs to check their feet for signs of melanoma. About the same number of African Americans and Caucasians develop melanoma on a foot. I wanted to draw attention to this because oftentimes it goes unaddressed, and I wanted to be able to share with you the ABCDEs to be able to look at your own feet and skin, that if there is something that is different that you haven't seen before, that you need to report it. Oftentimes you report it to dermatology. The dermatologist is the person who sees about skin, or you report it to your primary care doctor who could examine it and be able to say, you know, something, let's escalate this a little bit more. So therefore it's important that you check your feet either daily or weekly. For the person who is diabetic, I'm going to say that you have to check your feet daily. A picture of a Papa Marley lost his life due to a type of melanoma. He was diagnosed, I believe, in 1977. And his diagnosis came about because he had a football injury. That is what sparked the investigation. He was told that it was quickly identified as a melanoma. He was told that amputation was the way to go to save his foot and his life, but because of his faith, he decided against it. Unfortunately for him, the cancer was aggressive. And when he did decide to seek treatment, it was too late. So early detection can save a life. So I want to say foot care is collaborative. Foot care is a collaborative effort. It's an effort between, you have the foot care nurse, you have the podiatrist, you have your dermatologist, your primary doctor, you have your orthopedic doctor that deals with bone issues, you have physical therapy. Some of us need physical therapy to get our gait back together. Some people may even visit nail technicians, which is fine. However, things need to be, foot issues need to be identified, skin changes need to be identified so that you can get the help that is necessary. The ABCDEs of the melanoma. A is for asymmetry. When you look at a new mold or growth on your foot, you want to be able to look at that and say, does it look like a circle? Does it look irregular? If it looks irregular, it's a red flag. We go ahead to the border, the uneven borders. You know, we may look at something and you say to yourself, I never saw this before, but the borders may seem a little bit faded. They may seem a little bit jagged. So you want to make a note of that. You want to make a note of C, the color. Are you seeing a variety of colors in it? Sometimes something may look red. It may look like a bruise. It may look black. You want to be able to make a note of that. The diameter. You can use a pencil eraser to double check, because most of us don't have a small measure to really check, but they usually say that a pencil eraser will be able to identify, is this thing, you know, what's really going on here? And evolution. Sometimes you yourself might say, you know what, you know, I noticed my mother had that, or you know, I really did notice that before and nobody said anything about it. But if you notice that it's changing in size, it's changing in color, if you notice that it's bleeding, or you notice that you have a sore on your foot that's not healing, you want to be able to say, you know, something, this is a red flag. And I always say it's better to go into your doctor and for them to say that it is nothing, and to come back to me in 6 months than to stay home and for something to advance. Again, in Blacks, we tend to observe it more so on our hands and our feet because of the exposure to the sun. Next slide, doctor. Here is a client of mine that comes in. She comes in every 6 to 8 weeks for her feet. This is a new area of detection. So she is now referred to dermatology, and dermatology will be able to do an examination and be able to look at it under what they call dermoscopy, where he will be able to determine at that point, is this something of concern, and be able for her to be able to have follow-up with him. Everyone needs a winning team. This is the NFL, the 13th, I think next week, Sunday. The Rams and the Bengals are going in for Super Bowl 56. And just as we are all rooting for a winning team, as I said before, you too need a winning team when it comes to foot care. If you choose to go to your nail technician, you choose the foot care nurse, you need to see a podiatrist at least once a year. If you have orthopedic issues, for example, you may have a knee that's hurting. If you have corns or calluses that can throw off, or uneven hips, that can cause a painful back. If you have a knee, some people may have bursitis in your knee. You know, some people may have had knee surgery. You need rehab. So you need physical therapy. You need your orthopedic doctor. You need your dermatologist. You may even need your cardiologist, because coming in, I may observe that you're having swollen feet. Swollen feet by itself could mean, something, the valves in your feet as you get older may not be working. But then again, I may say, well, how often have you been having this? So your cardiologist, so everybody needs a winning team. So part of my job is the referral process to be able. I've had clients come in, they've had to have back surgery, they've had to have knee surgery. One client had to have a pacemaker done because the swelling in the foot was also indicative. In checking the radial pulse, I noticed that he was bradycardic. In checking up with cardiology, they were able to detect that something was going on and a pacemaker was necessary. So the feet do tell a story. Next slide, doctor. So what can you do at home for your feet? You need to inspect your feet daily. You need to wash your feet daily. You need to dry between your toes carefully. This could be done with a separate towel, a paper towel, tissue. Use powdered gels or foams that will dry. No cream between your toes. This will add moisture. Moisturize your skin. Whatever moisturizer you choose, use it consistently. If you can do twice a day, that will be idyllic. If not, once a day. Exfoliate weekly. You need to remove that dead skin, that hard skin. Your cream, your moisturizer, your oil, your emollient, whatever that you're using is not going to work over a rock solid surface. You need to alternate your footwear. Don't wear the same shoes every day. Spray shoes with a disinfectant spray and air dry them overnight. This will help eradicate fungus, fungal spores that are in your shoes. Also, too, if you have hyperhidrosis, it will allow the shoes to dry out. Change your insoles every 3 to 4 months for shoes that you wear regularly. This is a nail care routine that I have asked clients that they can follow. You just really need actually 3 things. One is a toothbrush, and you can do this. If you have gone to your doctor, your pedicurist, you can use a toothbrush with the same bath soap At home, you can use an old toothbrush or a soft bristle toothbrush, and at least 3 to 4 times a week, brush your toes, brush your toenails. This is going to help remove dirt and debris from around the nail plate and the sides of the toes, the lint. If you choose to use toothpaste, the hydrogen peroxide in it, just like it brightens your teeth, will brighten your toenails. The second image will show that this is the toenail after it has been cleaned. You notice it's a little bit dry. You can use a little oil. Oil at hand could be olive oil. It could be, if you have cuticle oil at home, whatever oil you have, if you choose to warm it up, you can. And give yourself some self-care. Go around the skin of the nails, around the nails, and hydrate it with the oil. And this you can do every day, 3 to 4 times a week. And at the same time, because you're doing this in the shower, in and out, just like you brush your teeth, you brush those nails, you rinse, you come out, you dry, you put your oil on, and you could also use that time to use a nail file and file the edge of the toenail, because the nail will be more pliable at that time. Next slide, doctor. Here is an example of the cosmetic enhancement. On the left, you will notice that the client has a history of toenail fungus or onychomycosis. This client was going on a trip and wanted his toenail to look a little bit more pleasing to the eye. So here I used a gel, was able to file that toenail down and use a gel enhancement. And this is the end product. So nobody has to know, and nobody knew. So he felt more confident going on his trip. Here we have the nail bracing that Dr. Cedric brought up. This is a young woman who had an injury to both toes. And because of that injury, after a while, the toenail became unfortunately infected with toenail fungus. We were able to put a brace on that toenail after she was seen by podiatry. So together with the brace and medication to address the onychomycosis, you could see the difference in the shape of that nail after the bracing. I use the image on the left to show you the brace that I do use, what it looks like on the nail. So again, all feet are beautiful, and all feet tell a story. So I encourage you, I always say, let's be part of your story, whatever the story is. You know, it's good to have a dialogue with whoever you choose as your foot care provider, to find out again about your shoes, about your socks, if things are happening, if you're having pain, to have it addressed.
Thank you so much for that, Nurse Griffith, for that wonderful and enlightening presentation. So just to continue with all the information you've given us, what are some ways in which we can get in touch with you?
You can certainly get in touch with me on my website, through my website, www.thefootcarern.com.
And I believe you also have social media. You have an Instagram?
I do. I'm on Instagram. I try to post as often as possible different scenarios that come into the office that may ring a bell for the person that's looking on.
And your handle is the Footcare RN, at the Footcare RN, correct?
Yes, it is.
Excellent. Thank you so much for that. Now, this is the part where our audience gets to ask you questions on the topic that you've just presented on, some of the things that they've just learned. So I want to
Sure.
call on the audience to unmute yourselves and certainly take advantage of this opportunity. For those of you who have a question, go ahead. Listen to the audio version of the Self-Care Forum podcast on Spotify, Apple, and Google Podcast.